Hi, this is Ajay Kumar and welcome all of you to my channel. I thank all of you who are watching my video and who have watched so far and has given a lot of love and affection, who has liked my video, who have shared and you have viewed my video. 6 months have passed and I have loaded several videos, and this is another edition of that. This is for the sole purpose of sharing our knowledge so that the uh, homeopathy as a whole would grow and we all homeopaths grow together. Dear viewers, today I am going to sharing my experience with fever cases. This is going to be very interesting session, and I hope that all of you in the end of this video, if you have watched throughout, will benefit a lot. In the beginning, long back, during my initial days of practice, when the case of fever came to me, there was fever in me itself. Because initially I had successive failures in the case of fever. However, my belief in homeopathy never faltered. I had firm belief in homeopathy, and I always thought that homeopathy doesn't fail, it is homeopath who fails. And I continued to work upon it, and later on I found that homeopathy works fantastically in the case of fever. And I remember not even a single case in the last few years where I have failed in the case of fever. It has given me a splendid result, even much beyond my expectation, and several cases were solved even in the same day. So this homeopathy in fever works much faster than any other system of medicine. I am not going to criticize anyone, just I am highlighting the benefits of the homeopathy in the case of fever, because in all other systems you will find that after fever, even if the fever is over with modern medicine, you will find a lot of accessory complaints and like constipation, malaise and weakness for a long time, even the fever is gone. But with homeopathy you will feel rejuvenated, you will feel uh, with vigor once the fever is over, and you will feel all normal like before. So this is one benefit. So let's start with my approach in fever. Dear friend, my approach is what Hahnemann has taught to me. Hahnemann has given in Organon all the directions how to deal with cases, and no homeopath has to follow apart from anything else. If you have firm belief in homeopathy and you follow the Organon, I don't think that any case of fever you will miss out in coming up with right simillimum. So before coming over how to approach through Organon, what is given in Organon, let's first check out a few cases so that I will be in better condition to make you understand how does it work and how Organon is so important and accurate. I am sharing my first case in which the lady was in a hospital, and she had taken heat stroke. She was 27 years old, and uh, she, she was lying right sided. I, I examined her palm and sole and found that the soles were cold, the palm was hot. There was dryness on the body, though it was summer, and there was fine on the top, but it was a lot of heat inside. She had been running fever, high fever. At the time when I examined her, she was having 104 fever. And before that, she had been on Bryonia and Arsenic, but they were not responding, and the fever was even rising. So, in that condition, I saw that case. I examined her tongue. The tongue was white coated, margins were clear, the coating was not so thick, and she said me that the fever had been since 3 days, and 3 days ago she worked in a farm. She was a laborer. She belongs to a labor community, and it was summer. The month was May, and the temperature was running around 44 degrees at that time. So under that sun she worked, and thereafter the fever appeared. She said that before the fever she had chilliness, and she had a lot of heaviness in the head, and during the fever she said that she had a lot of thrusts, and that the thrust was at intervals, and it was because of that thrust Bryonia was given earlier, but Bryonia was not working. I asked too many questions with her, but the important things of that case I am highlighting here, and I am presenting here for the shortage of time. I found that the lips were dry, the skin was dry, the perspiration was absent, and she told me that she is taking a lot of drink, but still she is feeling thirsty. Thereafter I asked her one question, that what does she like to eat? Which type of food does she like? She told me that she likes salty food. So my prescription was confirmed here, and I prescribed in that case Natrum. The reason of giving Natrum I will tell you later, but what happened after giving the prescription, that within 1 hour the fever came down to 103, and after 1.5 hours the lady was walking. The lady which had not been walking since morning, and she was on the bed lying. There was no appetite earlier, and she was only thirsty. Now she was walking, and the fever had came down to 101, and she ate some biscuits, and after 3 hours there was less than 99 degree Celsius fever. By evening there was no fever, and the lady was discharged from the IPD with the advice to report tomorrow. When she came the next day, there was no fever, there was only cough, and the cough had started as soon as the fever had started coming down. So at this point, next day I prescribed her Justicia adorata, and which cleared the case for cough. But here, why did I prescribe Natrum is important, and this is what you have to understand. My observation in this case was that when I was asking the lady questions, she was answering me properly. I didn't found on that lady any sort of letharginess and any disturbance by my questions. There was no anger, no irritation at that time, and that was the reason why Bryonia was differentiated here. Because in case of Bryonia, we will find that Bryonia doesn't want to share a lot many things, and she doesn't want to doesn't want even to answer. All that Bryonia needed at that time is rest, quiet, and no disturbance at all. Thou Bryonia is thirsty, and Natrum is also thirsty, but Bryonia thirst is over once she drinks, but Natrum is thirsty and it remains thirsty even after drink. That is the basic difference between the two medicines. And on that basis, Natrum was prescribed, and here I would like to differentiate with arsenic also, because in arsenic there is a lot of restlessness and there is a lot of weakness, there is a lot of prostration. I didn't found that much prostration here, and moreover she also told me that whenever there was chilliness, she used to cover all over his body. So here arsenic is also ruled out, because arsenic doesn't cover his body completely like Nux vomica. So all these differentiating point one have to understand while prescribing, because these are the gems of homeopathy, and without that you cannot prescribe a right simillimum. Now my second case is also of a hospitalized case, because the lady was under hospitalization, and moreover she was under ICU. She had gone under surgery, and after surgery she ran into fever, and the fever was running high continuously, and the situation had become critical to the sense that all the organs were becoming paralyzed and going into failure. Her urination was not working properly, lungs were not working, there was problem in respiration, and so she was on ventilation, and she had a lot of difficulty in respiration while lying down. And I found, when I visited her, I found that she was lying semi-erect condition. That was a condition in which she was feeling much better. There were cap over her nose and mouth, and her hands and legs were tied because she was trying to escape away from there. I found her face a bit red, and there was a lot of anger and fright on her face. The attendant told me that she always desired for water, but doctor had advised not to give him a lot of drink. So the attendant used to wipe with moist cloth her lips and face, and that is what all that she was given by the attendant. She was on nasal feeding, and this was the condition since 4 days. The WBC count was running very high, above 20,000, and the antibiotics were given, very costly antibiotics were given, but still the fever was not coming down. The lungs were not working properly, intestine were not working properly, the bowel movements was nil, bladder movement was nil. So she was going to multi-organ failure. What apart from it I collected in that collected from the attendant, because I could not be able to talk to the patient. She was thou conscious and looking at me, but she was her mouth and nose were covered by the cap, and she was unable to talk, and moreover I was not allowed to talk to the patient. I was taken by the relatives only to see the patient, and if I could find anything through observation regarding the medicine, I could help them. So when I asked the attendant told me that the lady want to escape from there. She tells me that, oh, you doctors will kill her, and if you don't give proper medicine, and if you kill her, she would complain about the doctors to the police stations, because she had a lot of relations in the police station. She had good rapport with a number of police officers, and she was very irritable at that time, and she used to scold even his own son. She wanted her son to take her away to home, or son to stay beside her, but the son was not allowed to do so. So this is this was all that I could collect from there. And on this basis, when I analyzed the case, I found that in that case, two or three things were very important. First thing, that was the condition was of septic condition, and there was a lot of inflammation in the body, internal inflammation, and with that inflammatory condition, the lady was going under paralysis of multiple organs. And at the mental level, I found that she was very very frightened, and she was fearing of death or being murdered, and she wanted to escape from there, and wanted his relatives to stay by her. And above all, which clinches the case in favor of Similimum, was that uh, her mental condition, of that she would complain to the police officer of nearby, with whom she had a good rapport. She she had a lot of relatives in the police, relatives as police officers. So there was a delusion of wealth in terms of relationship, and there was fear, and with that fear she wanted someone to stay by her, otherwise she would dead, and she would be died, or she would be put to death, or she would be murdered by the doctors. So with all these conditions, with a lot of thirst and dryness of the mouth, I prescribed her phosphorus, because phosphorus also has a lot of pathological condition of paralysis of lung and paralysis of kidney, and these paralysis occurs only after the inflammatory condition of the nerves and spine. So this case was a fit case, and moreover respiration of phosphorus is also better by lying in recumbent position. So this all these things clinches the case in favor of phosphorus, and after prescription of phosphorus, the lady, the very next day the fever came down rapidly, and the lady was put off the ventilation, and she was put on oxygen mask, and thereafter the next day, the lady was even off the oxygen mask, and and on the third day she was moved into general ward. So this is the power of homeopathy. This is the power of right simillimum. Even in such a grave case, how homeopathy works fast and how beautifully. This is a matter of great pride for all the homeopaths. I am sharing a third case in which a lady has fever since 2 days, and the fever is running high around 100 to 102. The son of that lady is MBBS doctor, and she was given on antipyretic for 2 days, still the fever was not coming down, and it was coming up after 6 hours of the tablets. So when she contacted me, and she complained that she had fever, body ache, and she has great discharges from the eye and nose. There was burning in the eye. When I inquired about why the fever happened to you, she said that 2 days before she had to go to collect her grandson from the school, and uh, she went with her husband on a scooty, and it was almost spring season, and the month was of February, March, and while returning back from the school, she gave her shawl which she had been wearing to the grandson, so that he could not get cold attack, and thereafter she got this fever. On this basis, I prescribed her Allium-Cepa, and after Allium-Cepa, the same day the fever went off, and her condition of eye and nose was much better, and the fever didn't return. What exactly happened in this case in my analysis was that she had a fever after getting cold attack, and the cold attack was was due to the exposure of wind, and the manifestation of the fever was where the discharges, acrid discharges from the eyes, and their watery discharges from the nose. So this was the condition like hay fever, and in such case, Allium-Cepa fits well. So Allium-Cepa worked very beautifully here. Another case, uh, I was consulted on telephone. One engineer from Pune contacted me, and he told that he has been under fever since last day, and uh, he has body ache, and the pain is more profound in the knee. The fever was running high around 100 degrees Celsius to 101 degrees Celsius. 100 degree Fahrenheit to 101 degree Fahrenheit, and there was a lot of lacrimation from the eyes. The eyes had become red. He sent me the snapshot of his eyes, in which I found that eyes were reddish. Though it was not too deep red, but it was reddish, and it looks dull. I asked why the fever had happened to him. He said that uh, last last day he had taken a bath at night, and the water was cold, and after that he had exposed himself to air condition for a long time, and from the next day the fever had occurred. It was summer, the month was of June, and on this basis I had a few remedies which I would like to differentiate with you. In the cases of fever, when the fever rises, and if you have pain in the knee, two medicines are very prominent: calcarea carb and natrum. And these two medicines are top graded medicine. It is followed by pulsatilla. And when the fever is high, and you have lacrimation from the eyes, the topmost medicine is pulsatilla. both natramure also takes cold, sensitive to cold, but the cold of natramure first attacks nose. The case was, in this case, the causation was exposure to cold. The person has taken cold, and he has taken cold in summer, and the effect of cold was primarily on the body temperature. Apart from it, I couldn't find any noticeable thing in this case. So if you go by the causation, and if the person has a tendency to catch cold, and if any element arises from there, calcarea cava and natramure doesn't cover this condition. That condition is well covered by pulsatilla. So in this case, pulsatilla was given, and after pulsatilla, the fever went down this very same day, and the next day the cough appeared. No medicine was prescribed, and I asked him to wait for a few days, and thereafter, after 2 days, when the report came, he was all okay. There was no fever, no cough, no coryza. Everything was fine. So, so far I have shared 4 cases of fever, and in all the cases homeopathy worked very splendidly. So now let's check out how did I approach in all these cases. Dear friends, in all these cases I noticed nothing but what changes did take place at the level of mind and at the level of body. With fever, in the case where the lady had taken heat stroke, there was heaviness in the head, there was loss of appetite, the thirst was very extreme, unquenchable thirst, and there was dryness of skin. These were the changes, and at the mental level she was very proper, answering very properly. In the next case, that case was of after surgery. In that case, what changes did I notice at the level of body? That there was extreme thirst, there was redness of the face, and at the mental level there was a lot of fear. There was fear of death. She was fearing that she would be murdered, and there was lot of irritability and anger. She wanted someone to be at her side. She wanted to escape away from there. So the fear factor was too much. And at the pathological level, I found that there was multiple organ paralysis heading towards, and this paralysis was because of the inflammatory condition inside the body. So, and above all, the fraternity factor of phosphorus, that she had a lot of relation, and with that she would use that relation against the doctor if they kill her or if they damage her. So all this clears the case for phosphorus. In the case where the engineer in the engineer case, the causation was imported. The causation was taking cold, and ailments had started after taking cold. And in the case of lady also, which has taken fever after going to collect her grandson, she had also taken cold, and ailments had started after taking cold. So In both the causation were similar, but the manifestations were different. In one case there was lacrimation only from the eyes, and in another case there was lacrimation from eyes as well as the nose. In one case the lacrimation was bland, and in another case the lacrimation was acrid. And that was the differentiating point between pulsatilla and Allium cepa. Another important thing in which pulsatilla was given, the changes at the level of body was the pain in the extremities, particularly in the knee, and change in the eyes. There was lacrimation, bland lacrimation, copious lacrimation, which was increasing as the fever was rising. So this is you have to catch in your clinic. This you have to notice in your cases, and if you are able to do so, I do think that in none of the cases of fever you will ever fail. What you have to point out, what you have to notice is the important things, the intense thing, the characteristic changes in the body at the level of mind and at the level of body. And this is exactly what Hahnemann has said in aphorism number 6. Hahnemann has said that a prescriber has to become a keen observer, and he has to observe nothing but the changes at the level of mind and at the level of body. And in acute cases he suggested has to take notice of the most probable cause of the condition. So if you take notice of the causation and you take notice of the changes in the patient, I do think that you will never fail. And this is the crux of homeopathy in cases of fever, as far as I am concerned. And as it has been said by Hahnemann, there is no doubt about it. If you rely upon it, if you practice upon it, and if you notice the characteristic feature in each case, as per aphorism number 153, as per the Organon, where you have to find out peculiar, singular, uncommon, unique symptoms, I do think you will never fail. So dear friend, this is all I have to say for today, and I hope that you have benefited from this session, and I do hope I will come with more and more cases, more and more ideas, more and more approaches, and more and more experiences in homeopathy. And I do request all of you to subscribe my channel if you have not subscribed. Do like my channel, do share, and do comment also. And if you like any topic upon which I should make a video, you WhatsApp me. I will certainly do upon that. So thank you very much. Bye bye.